This question is from Kurt Jensen from Columbia.
You can't read it.
Okay.
Good luck with that.
Okay.
First of all, thank you for coming through the state and hearing what everybody else has said. I do appreciate that. I also want to thank everybody in the room for coming here, whether you're for the reform or against reform. This is democracy. This is messy. This is what it takes.
So we got to get to your question.
I will have to do it. Speaking of democracy, less than a year ago we had a presidential election, and over 69 million Americans voted for Barack Obama. We had an election, and we had 60 Democratic senators, and we have an overwhelming majority of representatives in the House. It seems that we've got the 3 or 4 bills come out of the House so far, and we're down to the 3 and 3, we're getting 6 in the Senate. How is it that a country that is so overwhelmingly voted for the Democratic platform, the Democratic Party, the Democratic president, is now left in negotiating with 3 Republicans who have no interest in truly reforming health care? What can you as a senator do to help get that impasse passed and get some reform done for us?
Well, let me say this. I certainly understand the point you make, but my job is to represent Missouri. And it is, it's not the same job as, frankly, even your congressman. It's just to represent this area. Okay? I have the delightful, wonderful opportunity to represent the whole state. And we're talking about a 50-50 state. In fact, we had the closest election in America when it came to the presidential election. No state had a closer election than we did. And it's a normal day for me when the folks that are, way to the right and the folks that are way to the left are both mad at me. I passed my first amendment in the Senate, and the vote was 51-49. And one of the old senators walked up to me and said, well, Claire, we're going to have to start making fun of you. That's a pretty close count on your amendment. And I looked at him and I said, Senator, in Missouri, we call that a landslide. So my job is to try to find the best policy for the state I work for. And that's what my job is. That doesn't mean that I support everything that President Obama supports. It certainly doesn't mean I'm against President Obama. Obviously, I supported President Obama because I believed he was the strongest candidate for president. And I thought he was going to make the best president that we needed right now. But that doesn't mean that I agree with him on everything. And so my job is to look at these bills and try to find something that will reform insurance. I guarantee you I cannot find 4 people in this room that are not paying more money out of their pocket today for health care than they were last year, the year before, and the year before that. So the second thing I'm looking for is to make sure people have choices, that we don't have one size fits all, that we have a competitive marketplace for insurance in the United States. And the third thing is we have got to do something about escalating healthcare costs in this country because of our deficit. So, those are the 3 things I'm looking for. And whatever we can do to get to that, those are my 3 goals. And I am going to try to look at all the bills and try to find the best way to move forward, and hopefully we will accomplish those 3 goals. Because I think that's primarily the goals the president has, regardless of what people may believe. I believe that he wants those 3 things also. So hopefully that can get done.